infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
We talked about this a while back about the CDC and its changing of its position. Shouldn't its position simply be driven by public health and what's best for public health?
Yeah, absolutely. It was a big mistake by the CDC to make that announcement about not requiring any testing after 5 days of having COVID. You know, vaccinated and unvaccinated. The criticism was pretty swift, and they've changed, or they're in the process of changing.
And they say they might require this testing to happen, but I got to tell you, I'm sure you've talked to people too. These rapid tests, they're negative, they're positive the next day, and some PCRs seem to be a little bit off too. What do you tell people about that? Is there a problem with these, or is there improvement to be made?
Yeah, there's none of this stuff is perfect.
Yeah.
Right. But I think what if you mix the science of what is really happening after 5 days of symptoms, there's very little virus in most people. So, you know, those tests will pick up the few people that still have a lot of virus. And so any test is better than no test. And I think we need to accept that.
Even if it's giving a wrong result?
Well, I mean, it's more likely to give a correct result.
So you're less likely to get a false positive than a false negative?
Oh, yeah, yeah. If somebody, these are people with COVID. You're worried about the ones that have a false negative. Not a false positive.
Gotcha.
So should kids going back to school, should they be tested, and how frequently should they be tested? Once a week? And do we have the supplies for such a procedure?
We don't have the supplies right now. But if they're vaccinated, probably, and it's going to depend on where we are in the pandemic, what month it is, what the test positive ratio is. The testing should be implemented if they can get a hold of the tests. Right now, that's the real problem. But the vaccination is going to lower the whole burden on the testing process.
The U.S. is saying COVID deaths and hospitalizations comparatively low with this Omicron variant. So does that mean that these mandates should lessen? Should we be less concerned about this as we go forward?
Well, I mean, it's great that the hospitalization severe disease part is less than expected. That's fantastic. However, the overall numbers are so great that the governor has actually put in a request to halt non-emergency procedures and surgeries because the hospitals are nearing their capacity at this particular point. That's the problem. So it's a numbers game. Yes, it's less severe, but there's more cases.
All right, let's get to viewer questions. My kids got their second dose a week ago. I was wondering if they would have to quarantine in the future in case someone in their classroom has COVID-19. I know that CDC guidelines say that only people who have a booster and no symptoms don't have to quarantine.
Well, there's one caveat here. If they're within 6 months of their second dose, or if it was a Johnson & Johnson, which they probably didn't get, it would be after the first dose, they're still eligible. They still don't have to quarantine because they're not eligible for booster until 6 months after that. So if it's within 6 months, which most kids are, they're okay. If it's after 6 months, they have to get the booster, and it looks like that may be approved today for 12 to 15-year-olds.
All right, this person says, in my family of 5, only one of us tested positive. Did that family member have COVID, or was he the victim of another flawed false positive test?
Well, it kind of depends. If they're most likely talking about a rapid test here. 1 out of 5, if the person had no symptoms, I would say that's very highly likely to be a false positive. But any positive or negative test that you have some kind of suspicion, go get a molecular test like a PCR.
All right. If you did not get your question answered, Dr. Murphy answers them biweekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or go to our Morning News Facebook page and post the question there. We'll talk to him again on Friday. Thanks, Doctor.
Thanks, Doctor.